I'm here with 1st District Congressman candidate Marty Olsen, who's running on the Democrat ticket. And Marty, first off, just tell us a little bit about yourself.
Well, I've lived in Johnson City, Tennessee for 25 years. I was born in West Virginia, so I'm a native Appalachian. This is a great place to live. It's been a great place to raise my daughter. I'm a physician, and I'm a physician in a medical school, which means that in addition to take care of patients, I also have experience with innovation. I invented a surgical simulation device. I have business experience because I ran a department, and I've got international experience because I've had the opportunity to travel to Iraq 15 times and teach maternal safety courses there. So I think I bring a wide range of experience to my run for Congress.
And why have you decided to run for election?
It was healthcare that made me decide that I needed to step up. I take care of patients who have treatable diseases, but they're too sick to work, and because they don't have a job, they don't have insurance. Because they don't have insurance, they can't get better. And it is just very sad, and it's also very wasteful to have a person that wants to work but can't get back to work because of a treatable health problem. And these are people in our district, these are our neighbors, and I felt that I needed to step up and stand up for these folks. Our current congressman has tried to actually increase the number of people that would face this problem, and I felt that as a physician myself, I was the right person to stand up and say, no, there's a better way to do things.
And what do you think is the biggest issue the United States is facing currently?
I really do think it is health care that we're facing. Health care is extremely expensive. The federal government budget itself is $1 trillion, trillion with a T, and that's about 1/3 of the health, so it's $3 trillion for our country, and we just can't go on spending more and spending more and spending more. And there are steps that we can take to be more efficient. We can certainly look at the excessive costs we're paying in the pharmaceutical industry, and we can expand healthcare access for people without increasing the cost of the system. There's enough fat in the system there that we can trim that fat and we can take care of more patients.
And what do you think, narrowing it down, is the biggest issue that Tennessee is facing?
Well, certainly for our district, the biggest issue is the opioid epidemic. And I take care of pregnant women who are addicted to opioids. I help them try to decrease the dose of their medications so their babies aren't born in an addicted fashion. And I've seen human beings that are motivated to improve their lives, and they just need somebody to help them, and they can't find the help that they need. So I really think that there's a real possibility here for us to stem the opioid epidemic. And the opioid epidemic is not just a tragedy for the patients affected and not just for their families. It's actually an economic problem for our region because employers are afraid to move here. They're afraid that if they come here, they won't be able to find employees that can pass drug screens, and so they take their business elsewhere. So we really need to face this not just for humanitarian reasons. We need to face this for economic reasons because it could really drag our entire region down even further.
And what are your plans if you're elected to the U.S. Congress?
Well, I'd like to be on the Justice Committee because I really strongly believe that we need to enforce the laws we already have, and there are so many laws that aren't being enforced that I'd like to bring that concept of if we're going to make a law, then we have to have a plan to enforce it. We can't just make it and then pat ourselves on the back and move on to make a new law. We have to find a mechanism to enforce those laws. So I would hope that would be on that committee. I would also believe that as the only congressman who's actually helped people get off of their opioids, that I would have a real strong voice, even as a freshman congressman, in making policy to address the opioid epidemic.
And is there anything else you'd like to say before we go?
Well, I'd like to thank you for this opportunity. I think that things in Congress right now are a little bit too fractious between the different factions. I think there's a better way. I think a moderate like myself can bring people together. I think my plan is to let's talk about the things that we can agree on and let's start solving some problems.
That was Marty Olsen. He is running for 1st District U.S. Congress on the Democrat ticket.